I'm pleased to be able to speak to you a little bit about some work that we did within the Medley program at UHN. And really this work is the reflection of the work of our Medley coordinators, our cardiologists who serve as most responsible providers, and the team behind the scenes. So one of the dynamics that's great about a digital therapeutic is, of course, getting patients to actively use it, getting providers engaged in the program. And really, Medley has become the standard of care at UHN. It has been for a number of years. And we were becoming a little bit, not the victims of our own success, but really thinking about where we were with the program as we were mature and how to make sure that it was optimized. And so we know that the program has had fantastic results with reducing hospitalization, reducing certainly not only the experience of heart failure in terms of increasing the experience of self-management, and really has become taken up as really the primary offering within our program, and also has grown. It's grown across the street to Women's College and Mount Sinai, to Sunnybrook, and is now also in a number of Ontario hospitals. So we wanted to think about how can this program not only efficiently support the remote management of patients, but how can we also know when it's time to appropriately discharge or offboard a patient. And we had become really quite extensive. We had onboarded 500 patients to Medley during the COVID era because it was remote management and we could remotely onboard. And then we were really reflecting on, are the right people on Medley and are they where we want them to be? Have we achieved the objectives of the program? And so we decided to really systematically take a look at the program, develop a very structured approach to assessing, had patients reach the targets that they wanted? Were they stable? Were they adherent? And can we really think about offboarding as part of our standard operation of the project? And so that this is what this project was all about. So this project was developed in a way that really engaged not only those who delivered the program, but also the patients, to make sure that everyone was clear about what we were doing, why we were doing it, and that also that we could assess whether we had achieved the goals, and that patients were feeling that they could manage without Medley, and that we had the right people in the program. We developed a set of criteria, which we then applied. And we were really trying to understand three things. You know, was this offboarding protocol, was it effective? Was it being well received? Was it a good experience for everyone involved? And did we have the right supports in place? Because of course, when you're implementing things, you can't do these things in an ether. So at the time that we did this, which was really about a year ago, and it took place over 6 months, there were 179 patients who were identified. And of those, 154 were successfully offboarded. And of course, this represented 25% of our patients who were on Medley. And when we looked at the reasons for the offboard, some of them were patients who had been on for some time and were no longer adherent. Perhaps they didn't want to be on Medley anymore. They didn't want to continue to do a remote management program. The bulk were stable patients. And then also we had some patients, who potentially had died or who had become candidates for other more advanced therapies. One of the things that we did was we were really making sure that patients felt secure and knowledgeable about what was happening, that they understood why they had been identified, they understood the process, and they also knew where to go, because we didn't want them to feel like they were just being discharged with no sense of connectivity. And so we did a patient survey, which we were very pleased that 22% responded to, and some very nice comments where people talked about how the remote management program had made them feel sort of safe and connected, but because they knew how to return to the program, they were comfortable with the discharge. And also that they felt that they had some skills that they knew how to apply in order to continue to manage their condition. We also engaged the MRPs, of whom there's a number at UHN, and we had some good conversations about how offboarding helped them to also reduce some of their workload just in terms of the alerts and the volume, but also it made us think about what to do next in terms of the connection between offboarding of the Medley program and discharge from the heart function program. So just in conclusion, at the time, we had a significant number of patients who qualified for consideration for offboarding. A very significant number were offboarded, 154, and we continue to really apply and refine these criteria. I think one of the things we think about with digital therapeutics and any digital technology is we want to increase access, but you also have to make room for that access. So this really gave us the capacity. And the exciting thing is now it's 6 months since we finished the QI project, and we actually have more. We made a lot of room in the program, and we've onboarded successfully about 30 patients a month, and we now have as many patients as when we started the offboard project. So really achieved our goals in a good way. Thank you.